Welcome to Lesson 5 in Module 213, Physical Disabilities and Personal Care. This video is about epilepsy. And epilepsy is a diagnosis that is common in our field. It happens quite frequently with people who have cognitive disabilities and developmental disabilities, probably owing to the fact that both epilepsy and those disabilities are often caused by some type of neurological injury or neurological congenital problem. There are a lot of special precautions we need to be aware of because it's also fairly common in our sector for people to have uncontrolled epilepsy, meaning that their seizures are not necessarily well managed by medicine or only partly managed by medicine. And especially it's possible for people to fall and hurt themselves. So if they have seizures that cause them to fall quite frequently, there may be additional management strategies such as tie downs that keep them from falling out of their bed, or helmets that they have to wear throughout most of their day, or at least whenever they're walking. So understanding the person's care plan again becomes very important. Seizures are really just nothing more than uncontrolled electrical energy in our brains. Typically, electricity is moving along the nerves in our brain, very much the way it moves along the wires in the electrical grid of your town. And you can imagine the sort of havoc that would happen if it started jumping from one wire to the next. When a person is having a generalized seizure, that electrical activity has jumped the wires all throughout their brain. And it's a scary thing for other people, but it's not scary to the person who's having the seizure because they are actually unaware of the seizure. They're unconscious and they don't feel anything. That seizure activity is probably going to look like the person having a full body seizure, their whole body shaking. We'll talk more about the types of seizures in the next slide. But there are also focal, sometimes called partial seizures, in which only one part of the brain is affected, and it depends on what part of the brain is affected, and in terms of the actual symptoms or what you will witness from the other side. The person may actually become aware or be aware of what's going on in this particular case. So seizure disorder is kind of another replacement word for epilepsy. And by the way, we don't really use the word fit or convulsion anymore. Those are neither very accurate nor very dignified. But we do use the word seizures. So epilepsy is really the broad word for all of that. We usually think of people with epilepsy as having an ongoing neurological condition, but we don't always know what caused it. And when that happens, in medicine, when we don't know the cause of something, the fancy name for it is it's idiopathic. So this word here. So if somebody says they have an idiopathic ailment, and that's very common in epilepsy, they're saying it's not known why they have it. Sometimes people do know they have a pre-existing neurological condition. We've talked about strokes, for example, or people can have other birth defects or congenital hereditary disorders that are known to have epilepsy as a chief or side effect. Fevers can cause epileptic seizures, although typically they are short-lived. So can injuries to the brain or exposures to various toxins or drugs. There are a variety of different types of epilepsy or epileptic seizure. Myoclonic seizures are short and sudden, and they typically involve the shaking of one or more extremities or limbs. Absent seizures are sometimes referred to as petit mal seizures or small bads. And what they really look like to people often is an individual who seems to be daydreaming or maybe being non-compliant. They don't look like they're responding, or they're looking off into space. And that's how they get their name. The French called them absents, and it just simply means the person is absent. They're kind of looking away. These seizures are quite commonly thought of as behavioral problems at first in many cases, but if you start to look at the pattern and realize there really isn't a pattern, the person is looking vacant, not just when they're asked to do something, for example, you may have a person who's having these types of seizures on your hand. Tonic-Clonic seizures, which used to be called grand mal seizures or big bads, are the type of seizure most people probably picture when they think of epilepsy. In these types of seizures, the person is having a generalized seizure and their entire body is therefore involved. They usually fall to the ground and are in a laying on their back position usually, and their entire body may shake, or it may become entirely tight and tense and seem to loosen up and tighten up and loosen up and tighten up. And I've seen people who just tightened up. And these can last for a few seconds or a few minutes, and we'll talk about that more in a minute. Another type of petit mal seizure is called a startle or drop seizure. Now, drop seizures are a little bit different than startles. I'll start with them. Imagine the absent seizure we talked about earlier, but now the person is standing. Some folks stay standing, and other people fall when they have this type of seizure. So it becomes a drop seizure, and the name says it all. Startle seizures are similar. The person has a drop or an absence that's caused by something that startles them, often a loud noise or flashing lights. Temporal lobe seizures are a little bit different. The person may seem to behave differently because the seizure is happening in a localized part of the brain called the temporal lobe. And the person may act or say things that seem unusual, or they may be catatonic, sort of frozen in position. And the person may actually be aware later on that they had that seizure. What we're really mostly concerned about with people who have epilepsy are injuries that can be caused by the seizures if the person goes too long or if the person falls. Most of the time, the seizure itself does not have a lasting negative effect on the person. But we are particularly concerned about something called status epilepticus, which is a seizure that just continues on and on. Sometimes people don't have a seizure that lasts really long, but they have multiple little seizures in a row, so often and so many of them in a row that their body cannot get enough oxygen in or get proper circulation. And that's where we really become concerned, because during a tonic-clonic seizure, the brain is not getting oxygen. There's not really proper breathing. Even if you can hear the person exhaling air, they're not going to inhale air with efficiency. So this type of seizure can be fatal if it's not brought under control. And people who are at risk of these types of seizures usually have a seizure protocol. We'll speak about that more later on. And knowing when and how to call 911 for that person is very important, because they have a limited time before they're not getting enough oxygen to their brain. It's also important to understand that almost everybody who's an epileptic is going to be taking some type of medication. It can take quite a long time for individuals to have their medications individually kind of designed to meet their needs. There are a variety of different medications on the market, and every person's needs are a little bit different. Once that person's medications are in place, it becomes incredibly important for that person to have their medications regularly and consistently. If you start messing around with the times or missing doses, it starts to affect them because their blood serum level may diminish. And if a person has major changes in their health, such as major weight gain or loss, or if they have been sick for a period of time, then that can change their blood serum level as well. And so can a person having dental care. When people have dental care, sometimes what happens, these medications can have the side effect of causing gums to bleed. And so it's really important for us to understand that we have to be particularly careful about blood loss from injuries or from bleeding, and also anemia. All of these things can affect the person's health. I want you to make sure that you follow up on the links and readings that I'm attaching to this particular video, because there are some really important do's and don'ts of seizure response and some myths that I want you to be able to journal about and discuss in one of our review sessions. To wrap up this video, there is some specific stuff you need to know as a CSW. So one of the readings is first aid for CSWs, and you may see some differences in the various types of first aid documentation you see out there. But there are some really important things for us specifically as paraprofessionals to understand. First of all, we must know the person's protocol. People are individuals and everybody will have slightly different protocols. For example, the amount of time a person can go before we contact 911 will be different from one person to the next. I've worked with some folks who never had seizures and we called 911 anytime they had one. And I've worked with other people that we only called 911 if the seizure went more than 3 minutes, and lots of other variations in between. So you've already kind of guessed the next thing. All this time I've been telling you to wear a watch that has a second hand, and that's because it becomes incredibly important for you to note the time of the seizure and the duration of the seizure, which can be a hard thing to remind yourself to do when sort of the shocking event happens. But it's really important to do that and to document it. Even if the particular seizure that you witnessed does not go long enough to lead to a person having to have 911 called, If, for example, your documented seizure is part of a larger data picture and shows that the person is having more seizures or longer seizures recently, then it might be a warning sign that their medications need to be adjusted or something else in their healthcare plan. We also need to be aware of the fact that other people often don't know what to do around seizures and may do the wrong thing. They may come and hold people down or put things in their mouths, for example. Managing the crowd can be an important part of things and letting them know that you are aware of what to do. And don't forget that the crowd can involve other people that are supported by you, and they may be shocked or scared by what they're seeing too. Monitor the area for safety. Sometimes you'll see things that say we should roll the person over. That is not typically considered accepted first aid in most cases, unless a person is at risk. So for example, if they're on a sidewalk and about to roll into traffic, or if they're on the edge of a pier, then you might move them. But more often than not, what we do is cushion people. Perhaps we take our coat off, or we have a pillow or couch cushion that we put under their head, or we even stand between themselves and where they might roll and harm themselves. So instead, we want to kind of monitor them for safety. I'm more concerned about things like a person hitting their head on the pavement as they seize than I am about a person not being in a good body position. Moving them can put them at risk and you, because they don't have control and their body is moving sometimes with great force, and you can actually get struck by this when it happens. After the person's seizure, it's important to monitor and check to see whether or not they've had any other injuries. So for example, I have seen people get bleeds on their head that weren't immediately noticeable because they were inside of the person's hair, so you had to check afterwards, or see if they've got bruises or contusions, which are swellings. Make sure as well that you check on the person in terms of their aftercare. For example, they may need to use the bathroom. That's very common. They may be confused or unaware of what's going on. They may be embarrassed. Perhaps their consciousness is affected or their alertness, and so it might be necessary to adjust whatever activities are planned for that day, as well as to notify others who are working with you or will be working with you. If you have to go with a person to the hospital or meet them at the hospital, you'll clearly have to inform your coworkers and supervisor as well. So document all of that, but also make sure you have personal conversations by phone or face-to-face so that you're confident people have heard and responded to what you've shared with them. So this is just a quick overview on epilepsy. And again, remember, there are readings and links that I would like you to check out and be able to answer questions about. This isn't all of the content.